Welcome to Evergreen Family Medicine. Today we have the CEO of Evergreen Family Medicine, Dr. Tim Powell, with us, and IT lead and electronic health records specialist, Crystal Lane. Hello.
Hello.
Hey, Brian.
Hey, we get a chance to talk about school-based healthcare today. I know it's a topic near and dear to your heart, Dr. Powell.
It really is, Brian, and I'll tell you why, because it's totally about access. What this allows parents is an opportunity for their child to be seen at school without the need of taking time off work, without the need of transportation, by folks they know, and it allows that child to miss less school. And that's important because you can't teach a child that's not there. This child can sit in the classroom until it's ready to be seen and then come and if there's a prescription, we can call it into the pharmacy and the parents can pick that up later. So it's truly about access.
This is a huge county. It's the size of Connecticut. And it takes a lot of time to drive from one end to the other, doesn't it, Krista?
It does take a long time, and a lot of our communities are very rural. It's a 30-minute drive to Roseburg. It's difficult for the parents to make it in to Roseburg to the school to get the kid, then to drive to Roseburg, then take the kid back to school or home, go back to work, school, whatever it is they have going. This gives them the ability to see, to have their kids seen where they're at without the travel time and having to leave their work or school or whatever it is that they're required to be at.
You know, I think about that parent, Brian, in the morning and their child's sick, do I send them to school or not? So they have a choice. They can either keep them home and be safe, or they can send them to school and hope they aren't contagious. This takes the doubt out of it. Let's check your child out, and we have a nurse on site there, which is incredible because not only can she take vital signs, but she can do tests for COVID or strep throat or mono, or do a urine test for urinary tract infection or whatever the requirement is. And most of the time, your child will be fine to stay in school, and we'll keep him there. If he has strep throat or something he needs treated, we can manage that. But then you're not guessing.
And the best part about that is the parent can join remotely. They can get on their computer or cell phone, and they can join that visit with their child and the provider without having to leave where they're at.
And I think that's the important part, is involving the parent. It's critical. Sometimes we think about school-based healthcare and they think, well, my child's going to find their way to the school nurse or whatever, and I have no idea what's happening. We won't be seeing your child without, first of all, your consent, without your knowledge, and without an invitation to join in. So there's not if you will, a loss of control.
The parents will also be able to fill out the consent online, so they don't have to come to the school and fill out a piece of paper and sign it. They can just go to our website or the school's website and fill out the electronic form and give consent for their child to be seen.
The interesting thing with this, Brian, is why we've very much offered it, and the intention is the student. We also are happy to see all the school staff, and we have seen a ton of them, teachers, and that decreases the need for substitute teachers. And so truly everybody wins there.
So what would a typical school-based healthcare visit at a school look like?
Brian, this is so cool. And I get to talk about from the provider standpoint, and Crystal has to make it happen, because she's IT. And believe me, her job is more difficult than mine most of the time. But what we have, I mentioned we have a nurse there on site, and that's critical because they can take blood pressure and pulse and temperature, and mainly just have the student feel at ease with us, and then they hook them up remotely. Our technology allows us not only to look at them like we're looking at one another right now, it allows us to listen to their heart and lungs. We can look at their ears, nose, and throat. Their eardrum, tympanic membrane, we call it, fills my entire computer screen. Their throat or pharynx, that's a scary sight. I can tell you sometimes it looks like you're going to be swallowed, but it's great, and it's fun, and it allows us to do an exam really equivalent to what we could do if they were in person.
We have equipment that the nurse runs at the schools where it gives them the ability to look in the ear, look in the throat, listen to heart sounds, listen to lung sounds, They can take pictures, look at skin, take your temperature, and it remotes right back to the provider so the provider can see everything like Dr. Tim said. They can even record the heart sounds and put it in the chart. They can take pictures and put it in the chart. And then it has the telehealth ability, so you can see it face to face through the devices.
Couple other details on this. One is, do you have to be an Evergreen patient? Does the child have to be a patient of Evergreen?
Yeah, that's a great question. We get asked that a lot. Absolutely not. We'll see every child, every single child, every time. It's really no different than if they were to come to our urgent care and be seen. Except we come to you. We'll be happy to send a copy of what we did in the report to your PCP, so they're kept involved. So yeah, we'll see any child.
And is there a cost involved?
Well, there is a cost. That is to say, we never charge the student, we never charge the school for this service, but if there is insurance, we bill the insurance. And if there are children without insurance, we'll work with the parents, if they desire us to do that, with our community health workers to help them find coverage. A lot of these kids, probably almost all these kids, are eligible if they desire for the Oregon Health Plan, where they can receive care without cost, and we'll help them with that.
School-based health care is here in Douglas County thanks to Evergreen Family Medicine. You can find the page that Crystal talked about for consent or to learn more about school-based health online at evergreenfamilymedicine.com. And you can also follow Evergreen to see all the things that are happening on our various social media profiles and pages on YouTube, Facebook, Instagram, and Twitter.